Joel Embiid is out for Game 5 and considered day-to-day after an MRI revealed a small meniscus tear in his knee. Welcome back, everybody. I'm Dr. Brian Sutterer, and this is your #1 source for learning about the unique medical side of the world of sports. Now, this was the play back in Game 4 when Embiid got hurt. He went up for this layup here, and we can see as he came down, he does kind of jar that right knee a little bit. We could see a sudden kind of rapid flexion boom right there as it kind of bent. But then obviously when he fell to the ground, the biggest amount of pain seemed to be from his back, just from landing on the court. To be honest, when I first saw this live, I didn't think of any specific obvious injury pattern, just because this doesn't look like a classic mechanism for anything. And guys are constantly falling, bending their legs and twisting their knees in funny ways and being just fine. But now, of course, we've seen the results of the MRI stating that Embiid has a small lateral meniscus tear in his right knee, out for Game 5 and considered day-to-day. Obviously, the big question here is, what is his status going to be for the rest of the playoffs? And yes, I think there's a decent chance he still plays this postseason, but there's a lot of unknowns here that will influence that decision. It's pretty easy to look back at these injuries in hindsight once we know the diagnosis and kind of piece things together with how it happened. But here, of course, if we focus on Embiid's right knee, again, that's the knee that takes this kind of sudden jarring as he lands. And what I want you to focus on is how there's this sudden flexion. His knee goes from being relatively straight here as he lands to boom, right there in that sudden flexion where it's bent. And it also looks like the knee goes inward a little bit in terms of that right knee kind of coming over towards his left. If we think of our meniscus sitting within that knee joint to provide some cushioning, some shock absorption, and kind of force distribution through the knee, the meniscus gets loaded whenever that knee is put into more flexion, specifically kind of the back and middle portion of the meniscus. And so that transition from a straight knee to a sudden rapidly flexed knee with a little bit of inward lean there on the right knee is probably when the meniscus tear could have happened. If we look at our biodigital anatomy tool here, I've shown the knee joint and some of the key ligaments. And of course, we have our meniscus that sits here on the inside of this knee joint. And remember, we have two menisci. There's a medial, the one that sits on the inside, and then a lateral that sits on the outside. Looking from the top down here, we can see those. So this is going to be the medial on the inside portion of the knee joint and the lateral here on the outside. Embiid's is in the lateral or this outer meniscus. So if you think of the femur sitting on top of that meniscus with the tibia below it, that idea of that sudden flexion can sort of shear those fibers of the meniscus and potentially cause a tear. That combination of when the knee bends inward is going to narrow the space between this lateral femur and tibia and the knee joint to even further make that lateral meniscus tear possible. Like I said, there's certainly a chance he can play, but there are a ton of unknowns here that influence this decision. The first two are going to be, where is the tear and how big is it? Whenever we hear about players getting their meniscus trimmed out versus repaired, a lot of that comes down to the location of the tear and the potential to heal. The blood flow of the meniscus starts in the periphery and then works its way inward. So the outer portion of the meniscus is going to be the most blood enriched, and the inner portion is going to be essentially without much blood supply at all. This means that a meniscus tear that takes place more on the periphery of the meniscus in what we call the red zone is going to be more likely to heal if you do something like a repair. But a tear on this inner portion where there's bad blood supply is less likely to heal on its own, and so you're going to be more inclined to trim it out if it's causing bad enough symptoms. But there is a very wide spectrum in terms of severity of meniscus injuries and the subsequent symptoms that you can experience. It's very possible that this little meniscus tear is some tiny little ditzel that they saw in the MRI. This isn't like when you have either a broken bone or not a broken bone. If this is some tiny little tear that's not causing him any mechanical symptoms, yeah, I think there's definitely a chance he can play. But if this is some much larger tear that's causing persistent continued symptoms, maybe some mechanical symptoms where his knee is locking, then no, I'd say it's much less likely. But without having the MRI and knowing what his symptoms and his functional status is like, we really can't predict that. Also, remember, this is the playoffs where there's going to be a different threshold in terms of players coming back on the court. Is it possible we could see Embiid return but then have to undergo a surgery here in the offseason? Yes. Is it possible the symptoms calm down such that he's able to return in Game 6? Yes. It's also possible the meniscus tear was there from earlier in the season and it just wasn't causing any symptoms or issues until he had that hard fall. The fact that they've listed him day-to-day is certainly a good sign, because if he had a big enough meniscus tear that they knew was not going to recover in this time period, or was such that it was an area where they needed to operate on it, they wouldn't list him day to day. They would just say he was going to be out and miss the rest of the postseason. So to me, this implies that it's small enough and he's doing well enough that they think he can get those symptoms to calm down and functionally be able to make a go back on the court. So yes, it's possible we'll see him back in the playoffs, but because there's so much variety in terms of the size of a meniscus tear, the location of the tear, it's impossible to make any accurate prediction one way or the other. We'll see meniscus tears in clinic that basically kind of go around the entire meniscus or cut all the way through from the lower portion to the top top of the meniscus. But then we'll also see meniscus tears that are really just these tiniest of little cuts that we see. So unfortunately, we can't lump all these meniscus tears into just one generalization of how long someone is going to miss. So that's it for the video, everybody. Let me know as always any questions or comments down below. And until next time, we'll see you later. Bye.